slowly kind of connects.
Hey everyone, welcome to Kicking It with Kerry. We got
And
Jennifer Moeller here today.
OC Injector Jen.
OC Injector Jen. Yes, she's got it going on. You guys, we've all been wearing masks for a couple months, right? I think over a year now. We've been wearing these masks, right? I've got one right here underneath my thing. And we cover up the bottom part of our faces. Today I was so excited to put lip liner on and lip gloss because Jen did my lips like not too long ago. So I was like, mwah, get to show them off. But typically we are, just seeing like what's up here, right? Right up here. And so that's what we're going to focus on talking about today, right? So we've got some of Jen's favorites, and you've got the baller on a budget.
Yeah, well, I have a lot of patients that come in, and sometimes they're budget conscious, and so we have to be able to give a variety of options for those that are the baller on the budget, and then also those that are like fancy free and they have no budget. And so I think we can kind of explore all of it, and that way you can kind of pick and choose of like what you think is best for you, because like you said, like we've been covering half of our face up, for over a year now, and we still, we're still gonna have to wear it for a little while. How can we kind of accent our upper face because our lower face is all covered? Like what can make us kind of cute while we're wearing our little mask?
Yeah.
That's gonna be fun, and we can offer it in different budgets.
Right, and there's lots of things. I mean, the brows.
Yeah. Are we just gonna start there?
Let's start there.
Let's start there.
Brows, okay?
Brows. You don't know my opinion about brows?
Yeah.
Brows frame the face. In my opinion, brows frame the face. When you don't have any brows, it's like you don't have any eyes. Like there's nothing to outline the eyes.
Right.
And, one of my favorite treatments, and this is for the patient that is not on a budget, the patient that wants it all, is microblading.
Okay, what's microblading? I actually know what it is, but I'm just going to ask you.
I
know what it is.
We have Allie, who is a fantastic esthetician here in our office. She did my eyebrows, you can see, and it's semi-permanent, ink that's placed onto the brow and does not wash off for up to 18 months. And, she can shape it so that, she can give you the color that you want. So sometimes our blonde beauties that don't have any brows at all because there's no color, she can add color to it. She can add shape to it. Some of the older gals, as we age, our eyebrows get really thin. Or if you were like me and I overplucked mine into like little pencil skinny things back in the day, mine never grew back.
Right.
And so she just shapes them. And I think that, part of like when you have your mask on, is to have a brow to kind of frame your face. So
a little something going on.
A little something going on. So if, eyebrows microblading is definitely an option. Do we have a picture, a before and after picture? Is it up right now? Okay. Everybody give a high five or shout out. I'm loving the brows. Yes. It's amazing.
So, and I am more the baller on the budget type.
Okay. Baller on the budget.
Baller on the budget right here.
What are you going to do?
Well, I did the How Rich MD brow. So seriously, I don't think I put a picture of myself up there prepared very well. That's typical, but I did have a big old bald spot. Like I don't know what happened. Just old age, balding right here, and thinner, much thinner than they are right now. I started using this. It's $65 for a 5-month supply, and you just put it on daily. After you wash your face in the morning, and all of a sudden that bald spot was gone. It started to thicken the brow. I think I still could use a little bit of shaping and, maybe a little help there because it got a little out of control situation. But still framing my face, giving me something, to work with, and really easy to use and cost effective. So that's
How long does that little box last?
It's at 5 months for this one.
5 months?
I haven't gone through my first box yet. So, and I do see full improvement.
Yeah.
She's looking at her eyelashes. Do we want to cover eyelashes next?
Yeah, let's move on.
So, once again, I'm still on the budget. So
Ball on a budget. What are you going to do for your eyelashes?
Plus, I want to say the Latisse I had used for a long time.
I know.
And I loved it, but I did start to get some irritation. So I switched gears, and I started using both the lash and the brow at the same time.
Yeah.
And so easy applicator. It's like a mascara wand. You use one little thing every time, whereas Latisse, you've got a different brush every time. Sure. And you just line your lash line, and I've seen noticeable improvement in the length and the thickness of my brow. So I am a big fan of the How Rich MD lash serums and brow serums. What about when you're not on a budget?
When you're not on a budget, you know, you could do the good old-fashioned Latisse that's been around forever, and we all know how well that it works. It is a little maintenance as far as the brushes that when it comes. This whole box is like the Latisse is literally this big, so there's a lot of brushes as far as the maintenance. But you can just use one, put a dab on it, brush on it at night. It works very well. I've used it myself as well. It can cause a little bit of irritation above my upper lid, but I think the biggest question I get are for patients that they've heard that it can make your blue eyes turn brown, and that's just not true.
Not true.
You know, the studies were shown when they were using it to treat glaucoma, the active ingredient, they actually were putting it into their eye, which you don't put this into your eye, and it would make little brown flecks on patients that have green eyes. So there's been no study that has shown that Latisse causes any kind of browning of your blue eyes. So if you were ever afraid of that, don't be afraid, basically.
Right, and it does work really, really well.
It works really well. Yeah, the supply is usually about a 3 to 6 month supply, depending on how long you use it. So your options for your eyelashes are Latisse, which is I think it's 165 or 175, or
How Rich MD Lash, which is 65.
Yeah, so you know, ball on a budget, or you got no
and
budget.
if you go to our website, we're able to sell this one online, but we're not able to sell this one online. So don't try and find it on our website. That's the case for some things that are prescription strength. Some people ask me for things, why can't I find it on your website? It's because it's kind of prescription. So
you can come into the office.
Come into the office.
And then we'll sell it to you.
Yes.
Okay, so what's next now?
Well, I want to go to the bunnies, but we should save that.
We'll wait that for a second.
We'll save that because that's
what
just
about
what I'm all excited about.
The under eyes. I feel like the under eyes are, you know, something that is a big kind of complaint that I see like coming into the office a lot.
More common right now. Do you think it's because of the mask?
I totally, like, because look, when you look at me, you have like my whole face to kind of take in the information.
Right.
But when I go like this,
right,
it's like
just
right there, right? I mean, this is a lot of information. This, oh no, now you can see.
So if you've got a little sunken, you know, under eye area, it's more accentuated because of the mask. And we do get a lot more like calls about it. Questions and people come in getting treatments. Yes.
So we have a few different things. We have some creams, right?
Yes, lotions, potions.
I have my two favorite that I bought in. I think they're your favorite.
I use this one every day.
Which one is that? Tell me about it.
The Bright Eyes.
Why do you love it?
Well, it helps with dark circles, which I'm not like, I don't really have too many of those, but I do get puffy and it helps with that.
Yeah.
And I definitely have fine lines and wrinkles.
Yeah.
So it does help with that. I don't use this one too because I'm lazy and one is kind of a lot for me to do. So I know that this would probably be a good idea for me to use because it would hydrate.
Yeah.
Because I do also get dry. So this is called Bright Eyes. I think we sell it for $99, and it does have retinol in it to help with fine lines and circles, which with fine lines, other things help with the circles, but that's uncommon to find in an eye cream.
Yeah, and you know what else it has in it is caffeine, which can cause vasoconstriction of those little superficial blood vessels that are underneath the eye that can cause like that redness or that brownness that patients don't like. So I really like that if you have dark circles as a complaint. But you cannot leave behind the hydration.
Okay.
I'm sorry. So what happens if you don't hydrate underneath your eyes? Your skin is going to get dry, and then the wrinkles are going to appear more apparent. So a lot of times we just have to hydrate under the eye. I mean, how many times have you put makeup on, and then all of a sudden you go, oh my God, the wrinkles, they're like accentuated.
Do you think this like is good with makeup?
Absolutely.
Okay.
How I do it is, because I'm a little crazy, I will take a little pump.
That's a brand new one.
Brand new one. Okay. So you can see, I don't know, can you see this when I get up close? I don't know, my camera people, maybe, yes, maybe do. So that's the hyaluronic acid. And then this is the Bright Eyes, which is Kerry's favorite. And I just take them both and I mix them together. And then I pat around the eye, all around here. And I do that twice a day. And then I get the best, and then you go like this on the back of your hands. So you get the best of both worlds. You get to help with the wrinkles, you get to help the hydration, and then just all over you get, you know, a really nice result. So that would be kind of like the baller on a budget, I guess, right? The creams.
Right. That's a great combination. But really, this one's a baller on the budget.
That alone.
And this one is the one who's kind of like, yeah, I got money to spend. Let's do it. Let's do it upright. Let's get everything we need. Yeah.
And how about that next patient that really has like a little extra, you know, a little Bellatero is where I'd like to go. Do we have that photograph of the under eye filler? So, a lot of times patients will come in and they feel like they have, like, we call it the tear trough. It's where you start to see a little bit of a depression here where you have your orbital bone. And a lot of times we start to have some volume loss, and we can notice that it becomes more apparent. So for the appropriate patient, we do, Bellatero is my favorite. I do it with a cannula, and we just take hyaluronic acid, the gel, but we actually inject it in along that tear trough. Helps kind of puff it up, and that helps with a little bit of the shadowing that can occur with having under eye kind of bags, if you will.
It sounds like that would be a painful place to get injected.
You know what? I have found it is actually not painful at all. I do a little bit of lidocaine, and then I use a cannula, and I go in with a cannula, which is a blunt tip, and it just kind of wiggles around. And most patients are completely surprised with how little that they feel at all, because I do have the lidocaine. I actually have them open their eyes while I inject and look up while I inject, and they're completely fine. It's probably far more comfortable than injecting the lips, and I do lips all the time, and
What about like danger?
Yeah.
Level of danger treating. What?
Like well, no, we should be careful, right? If we're putting something into your face, we want to make sure that it's safe.
I'm curious. Like, is it a dangerous spot to inject?
Anywhere it's dangerous to inject, to be honest. We have optic nerves that run, and we have all different kinds of vessels and whatnot that we need to be very careful. But with a cannula, I think it's much more safe. There's less bruising, there's less swelling. But we should always be careful anytime we're injecting. I think that's a valid point.
People that are out there watching and curious about, safety, like who is it safe to get injected by? Do you have an opinion on that? Do you want to like stay out of that
as far as
like if they want to go to a med spa? I don't want to knock anybody. I really don't. Yeah. But like, would you feel comfortable doing that?
I think if it's an experienced injector that you know, and that you've seen their work, and they are licensed to inject, I think I'd like to stay on that plane.
Okay. Yeah. How do you become licensed to inject? I'm just
what
curious.
Are these questions?
I'm just curious because I'm not trying to stump you.
Okay, well you could be an MD to inject. You can be a PA. You can be an NP. You can even be an RN to inject. If you're an RN, you just have to be supervised by an MD. But you cannot inject if you're an esthetician, and be real careful about buying those like online things. Is that where you're going? I don't know where you're going with this.
I like to be, Kerry on the streets. Like, what are the layperson? What are they asking that maybe they're afraid to ask? And like get those questions out of the way. Go
to someone experienced, preferably Newport Beach Dermatology and Plastic Surgery, where we all have plenty of experience, and then you'll be in safe hands.
Talk about experience, because we do like injections upon injections upon injections. I mean, right?
Well, you tell me, aren't we like diamond level something or another? We've got some diamonds or some gold, or what are we?
We're big time.
Well, tell us about that, Kerry.
Well,
what does that mean?
So for we are Allergan in the top 1% of the nationwide for injectables. So that's kind of a big deal.
Awesome. Are we done?
No,
I was snapping congratulations.
Congratulations.
What else do we have left? Did we get some?
So now I want to talk about...
you go ahead.
So today, actually not today, I asked Jen today, but it's been bothering me for a while. I was looking, I never noticed this before. I was looking at my little eyes, and I was like, look at how, like, I've heard her say, let's inject the bunnies, and I thought I had like some cute little teeny tiny lines. But I look, and they're really thick. First off, are mine normal? Do people normally have little lines and mine are really thick? What's going on?
I think everybody's anatomy is different. Some people have little lines.
See right here.
Some people have bigger lines or deeper lines. I think it's so appropriate that you want to treat your bunnies just before Easter. Wonderful.
Yes. Thanks, Easter Bunny.
No, but the bunnies are kind of this, I always say, kind of make a squishy kind of face and make a little stinky face. And over time, you actually can see lines develop like this and along here, and they stay when you're not making that face. And it kind of looks like a little shriveled sausage on your nose or something.
I don't want a shriveled sausage on my nose. That sounds
I don't know. So we got to get rid of your bunnies, right?
Yeah, so let's do it.
So we're going to do Botox. There's Dysport, there's Botox, there's Xeomin, there's Jeuveau. I'm going to choose Botox. Botox is very precise. I can go exactly where that little wrinkle is, or that muscle is that's causing the wrinkle, to make that cute little bunny. And so I am just going to put on my little handy dandy glasses here.
We're going to do it right here.
We're going to just do it right here. Like, we can handle this.
Yes,
Can you guys see? Is this fun or not? What do you guys think? I mean, I don't know. Kicking it with Kerry, you know.
Yeah,
We're trying to keep it fun. Please hand me
this?
this. Thank you.
Do you want me to have my mask
Good.
on? Or we're both
Yeah,
vaccinated.
we're both and COVID tested and vaccinated.
Yes, that's true.
Okay. Here we go. Friends that vax together can play together.
Hell yeah.
Oh my gosh, this is like my first time getting Botox. Not at all true.
This is the closest I've ever been to a person in a year, though.
Yes, we're very close.
With no mask on.
Just so you guys can see.
With no mask on. Okay, here we go. Alrighty. So what I do is, I actually have to stand up. Okay. Make a little stinky face. So you see how this muscle right here is pulling and lifting and making this wrinkle? Relax. I like to hold on to that muscle because I see that's right where I need to put a nice amount of Botox. I'm actually going to put 5 units right there. And then go ahead and relax. Now make a little stinky face. And you see how it pulls right here? I'm going to put a little bit of Botox right there as well. There we go. Okay, go ahead and turn towards the camera and make a stinky face. You see how this pulls and goes like this right here? Relax. I'm going to go right here and get this muscle that's pulling down right here so she doesn't have a sausage nose. Just like that. Okay. Next.
How long will this take to work, Jen?
It's going to take 2 weeks for the full effect. Relax. See, I still hold that muscle there. It's kind of tender right here, but I just do real quick. Bunnies, just in time for Easter. Come in and let me poke your bunny. Oh, that wasn't good. Okay. Sorry. All right. And one more time, little stinky face. Relax. There we go. And so what this is going to do, it's going to make Kerry, when she has her mask on, or even with her mask off, it's going to be just smoother. So make that face again. It's just like she's got this mask of like little tiny wrinkles, and so we're going to smooth it out right here. That's it. Easy as that. No more bunnies.
So,
Any questions?
Yeah,
Any followers? How many people are watching anyway? Curious.
it's not very busy, but that's okay. We'll catch you guys on the flip side.
Thank you for whoever you are. There's
Thank
two.
you. Thank you. We appreciate
Three
you.
over here.
Oh, there's 3 over there and 2 over here.
Okay. But,
Want to end it?
so, if there's no questions,
Yeah.
thank you for joining us.
Thank
we really
you.
do appreciate it. You guys have a great day.
Bye.